In 1946, a group of 70 opinion research pioneers met in Central City, Colorado. Today, we celebrate our 75th conference with over 1,200 attendees. No matter how large APOR grows, this will always be the same. People build APOR, and people of APOR make us strong.
Your conference chair. 88 days ago, you and I started creating a virtual meeting place for the very first time in APOR's 75 years of history. Because no matter what happens, public opinion and survey researchers never stop empowering our world with facts. Now, I proudly present APOR members.
This is Lydia Saad of the Gallup organization. I have been with APOR as a member for 26 years and happy to be here today to talk about some COVID-19 data. I want to thank our conference chair, Mandy Shaw, for her introduction and for organizing the session. A particular set of data that we've been collecting on the Gallup panel, which is a probability-based panel, via web. We've been doing this poll daily since March 13th and wrapping it up in some weekly results. Full description of Gallup panel methods is available at that link. So here's a good summary of where we've come with social distancing from middle of March, when Americans first started to incorporate these behaviors because of concerns about the pandemic. And you can see the rapid increase in the percentages of Americans saying they are avoiding various forms of public contact. The gray line is avoiding travel, air and mass transit. The dark green line is avoiding public places, including stores and restaurants. And the lighter green line is avoiding small gatherings of friends and family. So all these things started off low, rocketed up to 80% or so adoption of these things by the end of March, and have remained quite high, especially through April, come down a bit in May, but we still have majorities of Americans saying they're doing these things. Now, at the same time that we have seen some decline in social distancing, we've seen a corresponding increase in people wearing face masks. So that's just a little counterpoint to point out that lack of social distancing in terms of not interacting with people doesn't necessarily mean people are not being responsible or careful if they're doing it with things like face masks. Will Americans maintain these practices going forward for as long as it takes to be out of this crisis? One question we've asked is, if it's up to you, how soon would you return to your normal day-to-day activities if there were no restrictions and no closures? Given 4 options, only 28% said they would get back to normal right now. And what's interesting about this is this has not increased over the last 4 weeks, even though there has been quite a bit of change in the kinds of businesses open and the infection rates in some states. Obviously, it's increased a lot since March, but it's sort of leveled off around 28%. Meanwhile, these are the other responses you can look at later, but we've still got 30% of Americans saying they're going to wait until there are no new cases, or 13% until a vaccine is developed, or 29% want to see those cases decline significantly. So majority of Americans in these more conservative groups wanting to see less risk of COVID-19 before they go back to normal. Similar finding here, if you're looking for a marker of when Americans would go back, looking for a decline in the percent worried about contracting COVID-19 would be one. We're not seeing that. Constant rates of those very or somewhat worried that they could get the virus. Also constant rates in those saying that the overall coronavirus situation in the US is getting better. Fewer than half have said that consistently. It's improved a little bit since early April, but hasn't gone up any further. We still have a majority, as you can see in the bottom half of the screen, saying the situation's getting worse or staying the same. Here's a trend that has gotten better. It's people's concern, their worry about availability of coronavirus tests and availability of hospital services, supplies, and treatment in their area. But as much as that's come down, we still have close to half of Americans saying they are still very or moderately worried about these aspects of public health surrounding COVID-19. And here is a kind of a nice lump sum question of what Americans think on the overall philosophy of whether we need to keep social distancing or get people back to work. There's still much more on the keep social distancing side. We say, what's the better advice right now for healthy people? 69% say it's to stay home as much as possible to avoid contracting or spreading the virus. 31% say to lead normal lives as much as possible and avoid interruptions to work and business. So still a long way to go before those lines cross. And then finally, what kind of pressure is coming from Americans' own stamina for enduring the emotional stress, the physical stress, and the financial hardship that goes along with social distancing? These gray columns are showing the percentages saying they can endure as long as necessary before encountering these hardships. You add in the dark gray columns saying they can go a few more months. You've got majorities saying they can go quite a bit longer before they personally are going to feel the pain in these areas. So right now, in some, it looks like Americans, they had a rapid uptake in social distancing. It's not going to be a rapid unwinding. They are clinging to these concerns. They are looking for much more significant signals that it's safe to go back to normal. To the extent they are going back to normal, they're wearing face masks, and we'll continue to monitor these trends. Thank you very much and enjoy the rest of the conference.
Hi, my name is Emily Swanson and I've been an APOR member for 8 years.
I'm Hannah Fingerhut and I've been a member nearly 5 years.
We're going to be talking about one of the unexpected ways that our research at the Associated Press shows partisanship playing out during the COVID-19 pandemic. To start off, we'd like to acknowledge the work of our colleague, Katie Perry, who's helped us with the graphics for this presentation. We're going to be looking at the results of several AP-NORC surveys conducted since March. All were conducted on NORC's probability-based AmeriSpeak panel and included about 1,000 US adults. Full methods details for all of these surveys can be found at apnorc.org. Way back in March, we noticed an interesting pattern. In states with Democratic governors, majorities of both Democrats and Republicans approved of how their state was handling the coronavirus outbreak. But in states with Republican governors, there was a partisan split. Most Republicans approved, but fewer Democrats did. This caught our eye because it's not the usual way partisanship plays out these days. You might expect to see a partisan split on both of these. One thing that was going on at this time is that most of those states with Democratic governors had already instituted stay-at-home orders when this poll began on March 26th, while most of those with Republican governors had not. And in fact, as the outbreak began, we actually saw almost no partisan gap in people's views on the response to the outbreak. As you can see here, Republicans were only slightly less likely than Democrats to support stay-at-home orders the first time we asked about this in March. That's changed a bit since then. By mid-May, a gap had started to open as Republicans became less likely to approve of stay-home orders. Yet it was still pretty close to half of Republicans who said that they supported these orders. So we're going to take a look at how things have developed since this March starting point, when states with Democratic governors had bipartisan support for handling the outbreak, while there was a partisan split on states with Republican governors. In states with Democratic governors, the pattern since then has been predictable. Democrats have been consistently supportive, with even a bit of an uptick in April, perhaps corresponding with more orders going into place. No surprises there. Republicans have become slightly less likely to say they approve of their state government's response in these states governed by Democrats. As a result, we see a partisan gap beginning to open up. It's not gigantic, but it's kind of what we might expect. In states with Republican governors, things get interesting. We've actually seen Democrats in these states have become more likely to approve of their state's handling of the outbreak, perhaps again giving credit for closures that they wanted. By April, nearly all states had instituted some kind of stay-home order, and most remained closed at the time of this May poll. But Republicans have actually become less likely to approve. In fact, the partisan gap we see now is almost identical to the one we saw in Democratic states, with Democrats somewhat more likely to approve than Republicans. So what's actually going on here? Well, recall that we saw overall support for stay-home orders sliding among Republicans, but still a solid percentage of Republicans favoring those orders. You can see here that among people who oppose stay-home orders, approval of the state government response has been consistently lower. This group is still too small to analyze by party over time, but it is predominantly Republican. Meanwhile, among both Democrats and Republicans who favor stay-home orders, and remember, this is still a pretty large chunk of Republicans, we've actually seen continued high support for state governments. So what we're actually seeing here is that the dip in Republican support for their state governments, even in state governments governed by Republicans, corresponds with that dip in support for stay-home orders. This appears to be happening in both Democratic and Republican governed states, and in both types of states, a significant subset of Republicans, those who favor stay-home orders, approve of their state government. It's a lot more complicated than the partisan patterns we've become accustomed to in recent years. Notably, as I said before, this May poll was conducted when only a couple of states had begun to reopen businesses. So it's a pattern that we'll continue to follow this month and beyond to find out what happens next and whether this continues to break the typical mold of partisanship. Thank you, and here's hoping we get to see you all in person to discuss all this in more detail next year.
This is Paul Lavrakis. I've been an APOR member for 36 years.
I've been an APOR member for 4 years.
I'm talking briefly today about some national surveying that I did with Scott Richards at Reconnect Research in my capacity as a consultant regarding the general public's reaction to the virus and the pandemic. In March and April, for over a 6-week period, Reconnect Research conducted over 16,000 interviews with adults in all 50 states using the RICS IVR surveying approach. RICS is a special telephone surveying approach, and IVR is, as you probably know, a data collection means in which there's no interviewer involved. For these surveys, the APOR RR1 response rate was about 9%, which is comparable to many general public RDD surveys. And one thing I want to note is that we found an overestimate exposure to the virus of approximately 1.2%, which was not necessarily a surprise. And we think that this is likely associated with differential non-response because people who thought they had the virus or were especially interested in it were more likely to complete the questionnaire, so we believe. Overall, what we found, and I think it's very interesting, is that the reactions of Republicans as a group compared to Democrats and independents were in line with how the president was characterizing the virus. In other words, as less serious than many medical experts were characterizing it, as was reported by the news media. Here you see the approval and how it differs by party affiliation, strikingly differs by party affiliation. And it was quite stable over these 6 weeks period. You'll see here that Republicans as a group pretty much were from the mid-70s to the upper 80s in their approval. And it sort of was ticking up towards the end. Independents, the orange line in the middle, started out a little higher than they finished up, with about approval of most of the time in the upper 50s. Democrats started a little higher the first 2 weeks and then dropped down into the 40s and seems to stabilize right there at about the mid-40s. As you heard me say earlier, Republicans were quite different in many ways, not just on government approval. What we found across the field period was that Republicans were consistently more likely to report that they were experiencing virus-like symptoms, yet they understood little or nothing about the virus. They believed that the virus spread was under control or that the spread of the virus would be under control within a couple of months. They had changed their lives very little or not at all because of the virus, and that they knew little or nothing about how to prevent the virus. Obviously, this isn't all Republicans, but they had a tendency, and it was a statistically significant tendency, to report these things much more likely than independents and Democrats. Thank you.
Hi, my name is Maria Vizarano, and I am from the Thomas and Dorothy Levy Center for the Study of Los Angeles, also known as Study LA at Loyola Marymount University. And I've been an APRO member for 1 year.
And my name is Brian Gilbert, also from Study LA. I have been an APOR member for 12 years. In the public opinion research world, rare is the opportunity to be called into service. However, that is exactly what happened earlier this year. In March, the mayor of Los Angeles, Eric Garcetti, called on our research team at LMU to help his team understand what Angelenos were thinking about and how they were reacting to the COVID-19 pandemic. Over the next week, by far our shortest timeline, our team developed, tested, translated, and programmed a survey to query 2,000 adult Angelenos. These 2,000 adults were all residents of Los Angeles County, and we contacted them via phone, both landline and cell, and online in both English and Spanish from March 23rd to April 8th. After data collection, the data were weighed, and we had a margin of error of plus or minus 2%. A link to the report is in our last slide, and the full methodology is here as well, as we are charter members of the Transparency Initiative. A quick glance at this demographic summary shows the representativeness of our survey with results from Angeleno residents. On this slide, we wanted to call out the percentage of residents that said they had someone in their household with at least one of the two main risk factors, either a serious medical condition or compromised immune system, or someone 65 or older. Nearly half of all of our residents said that someone in their household fit into at least one of these two categories.
And as for our survey results, here are some highlights, both for the entire sample of residents and broken down by geography, city of LA versus rest of the county. I will go over results for the entire sample. An overwhelming majority, 86% of Angelenos believe that the coronavirus is a real threat, and just 14% say that it is blown out of proportion. 95% of Angelenos support the decision to implement the safer at home order, and this support remains high across all racial and other demographic groups. Over half also believe that the local government's response to the pandemic has been just about right, and 1 in 3 say that it has not been enough. Asian respondents and younger Angelenos are the most likely groups to say that the response has not been enough. We also asked how much confidence residents have in the following individuals and groups to deal with the pandemic. Over 80% have confidence in their local health department, City of LA Mayor Garcetti, and California Governor Newsom. Only 38% have confidence in Trump to deal with the pandemic, which corresponds with other surveys we've done in our very liberal region. Another set of questions assessed how worried Angelenos are about their ability to perform a range of duties during the pandemic. More than half are somewhat or very worried about a number of issues listed here. By race, Latinos are the most worried, while Black respondents report the least amount of worry. These results are not surprising, especially as half of Angelenos report being let go or having their work hours reduced, with Latinos reporting these adverse events at a higher rate than other groups. And consequently, 58% of Angelenos had their household income streams reduced due to the pandemic. Again, Latinos are most likely to report a reduction in income. Another worrisome situation is that about 1 in 5 Angelenos have no one they can depend on for care, whether it's in or outside their household, making this difficult time much more difficult without a safety net of those around them. Some positive news, most respondents gave accurate answers to the ways one can protect themselves and others. You can see 3 out of 4 discussed the importance of social distancing in their open-ended responses to this question, and we have seen that public health messaging works. For instance, before LA County officially recommended that Angelenos wear masks outside, only 21% of survey respondents mentioned masks in their answers. After the official recommendation to wear masks was announced on April 3rd, half of respondents mentioned masks on the survey, a significant increase.
The results that Maria quickly reviewed are just a few of the highlights from our survey. Before we start a project, we always try to articulate our why so that we stay focused on the goal at hand. Having the opportunity to present to and discuss these findings with the mayor and his COVID response team on several occasions provided us with one of our biggest whys yet. In addition, the mayor included the findings during 6 of his nightly press conferences, including one where I had the opportunity to join him to share my highlights of the data. The results were also used to tailor public health messages for the demographic categories in geographic areas identified as least knowledgeable about COVID-19. And speaking of the data, our full report of all the tables and crosstabs of our survey is available at this bit.ly link. Thank you for your time and have a great rest of the conference.
Hi, my name is Roxana Elliott from Geopol, and I've been an APOR member for 5 years. Geopol is a full-service market research firm that works primarily in emerging markets such as Africa, Asia, and Latin America, and we conduct research through remote mobile-based methods that includes SMS, voice call, mobile web, and mobile application. We have been conducting studies on the impact of coronavirus in sub-Saharan Africa since March, and today I'm going to be going through some highlights from our most recent studies on how coronavirus is impacting those in sub-Saharan Africa. So the study I'll be going through today was run in 2 waves, one in early April and one in late April to early May of this year. And it was run in 12 countries throughout sub-Saharan Africa. You can see we have a good mix of countries in East Africa, West Africa, Central and Southern Africa. The study was run through SMS, in which a 2-way conversation is initiated with the respondent, and mobile web, which is a basic web link that can be opened up in a mobile browser. We had a sample size of 400 per country per wave and over 5,000 unique respondents who've participated in both waves of the study. One of the first things we looked at was the level of concern over coronavirus in sub-Saharan Africa, and we found that it was very high. 71% of respondents indicated that they are very concerned over coronavirus, and this was the case even in our first round of data collection, which was really just as the outbreak was starting in the region. We also looked into the most concerning aspect of the coronavirus pandemic, and here we found that while contracting the disease is the top concern for people, the economic impact is also a really big concern for those in sub-Saharan Africa. We know that a lot of countries in sub-Saharan Africa already have fairly fragile economies and rely a lot on informal trade, which will be impacted by the lockdowns and other restrictions that are in place due to coronavirus. We also looked at what preventative measures are being taken, finding that almost all respondents, 96%, indicated that they have taken measures to protect themselves from coronavirus. And when we looked into this more in depth, we found that increasing hygiene, so increasing hand washing and other hygienic activities, was the top item here, but some people are also working from home or avoiding public places. And then we looked specifically at self-quarantining as well, and we found again a quite high percent, 71% overall, said that they are already self-quarantining, although this answer varied a lot by country. So you can see that South Africa and Rwanda, which had early lockdown efforts, had higher levels of self-quarantining, whereas countries such as Tanzania and Benin, which have not had such strict lockdowns, had lower reported levels of self-quarantining. One of the main concerns over coronavirus and related restrictions in sub-Saharan Africa is how it will impact food security. Several of the countries included in this study already have high levels of food insecurity, and it's expected that the disruptions to the food supply chain and other items will make food security worse over time. And we found this to be true already with our respondents. We found that 80% indicated that within the 7 days prior to the survey, they were worried that they wouldn't have enough food to eat due to lack of money or other resources. We also observed changes in shopping behavior for both food and non-essential goods. So almost 60% said that they are shopping for food less often. And in terms of purchase of non-essential or consumer goods, we found a large majority, almost 70%, say that they are purchasing less non-essential goods. We also looked at how respondents think their governments are doing in terms of the actions they've taken to stop the spread of coronavirus. And here we also found quite mixed results dependent on country and what actions had already been taken. But overall, 55% said that their governments have done enough to stop the spread of coronavirus. So still almost half, 45%, did not think their governments had done enough to stop the spread. We also looked at the sources of information on coronavirus, as we know that there's been a lot of misinformation spread specifically on social media and channels such as WhatsApp in sub-Saharan Africa. And we did find that social media is one of the biggest sources of information on coronavirus, with 39% saying that that's their main source of information, compared to 44% who said that TV was their main source. Those are some of the highlights from our report. You can also find a full interactive dashboard and report available at geopol.com, and you can email me to get the raw data at roxana@geopol.com. Thanks, and I hope you enjoy the rest of the conference.
Hi, my name is Paul DePerna, and I'm with EdChoice. I've been an APOR member now for about 10 years. It's really good to be with all of you virtually, and I'm looking forward to our online conference over the next 2 days. At the beginning of this year, EdChoice and Morning Consult launched a new monthly tracking poll focused on K-12 education issues and schooling topics. In mid-March, we began including a handful of questions to learn how the coronavirus pandemic may be affecting public opinion on education questions. I will show you some of the things we've learned over the past few months. And here is what we call our survey profile, which we include for all of our surveys and polling work at EdChoice. For our purposes here, I'm highlighting the dates in March, April, and May when we fielded our tracking poll with the new COVID pandemic questions. And this is all being administered via non-probability sampling in online mode. For any given month, we are surveying approximately 2,200 general population respondents, and within that total sample, a little over 500 parents of K-12 school-age children. So just a few weeks ago, we started asking a question about how respondents felt their institutions were responding to the coronavirus pandemic. And Americans appear to be more likely to give high grades to their local institutions in their responses to the pandemic, especially their local schools. As we can see at the top of the chart, about 2/3 are giving A or B to local schools. And then down at the bottom, we see roughly 2 out of 5 respondents giving A's or B's to the federal government's response and to the national multinational corporations. Since March, we've been asking respondents how disruptive the coronavirus has been to each of the following. Here we see the percentages of those saying very disruptive to either their personal routine, their family household routine, or to their local community. So far, it's pretty clear that April has been the most disruptive month. At that time, majority said the pandemic was very disruptive to their communities. We can see by the darker blue shaded cells that majorities were saying in April the coronavirus pandemic had been very disruptive to their communities. And since April, we see these numbers have gone down by 8 to 10 percentage points. Over the last few months, we've also been asking school parents how prepared they felt facilitating online instruction, also known as e-learning, distance learning, or e-days. And being a father of 2 young girls in 2nd and 4th grade, this was surprising to me and to my wife. The solid majorities of school parents have said they felt at least somewhat prepared to facilitate online learning for their children. And so we see these 2 darker blue trend lines showing the somewhat prepared responses and the very prepared responses. And so they fluctuated anywhere from 3 out of 10 to a little more than a third saying either of those responses. And so in this most recent wave, 71% said they felt at least somewhat prepared for facilitating online learning. We're also asking parents how concerned they are about various aspects of the coronavirus pandemic and how that may be affecting schooling of their children. And parents have had a wide range of concerns about COVID, but as of May, appear to be most worried about missed instruction time, about 80% saying they were at least somewhat concerned, or exposure for their children at school, where it's about 3/4 saying at least somewhat concerned. And on either of those responses, at least half of parents are saying that they're very worried and concerned about their child missing instruction time and their child being exposed to coronavirus at school. And these numbers could have some significant implications for the future in the fall when we're considering how we reopen schools. And so with families and parents becoming homeschoolers to some degree over the last few months, we felt it was important to ask how their opinions towards homeschooling may have changed as a result of the coronavirus pandemic. And we can see that since March, the positive sentiment has been fairly stable, at least half saying that they're much or somewhat more favorable towards homeschooling. But we've seen since March that there is acceleration of negative sentiment going up 12 points since March, 17%, 29% in May. Sentiment appears to be fairly stable and the negative sentiment appears to be accelerating a little bit. And then we've asked, based on what they've seen, read, or heard about the coronavirus pandemic and outbreak, how comfortable would school parents feel about returning their children to school this fall? And right now, school parents' responses vary widely and pretty evenly across responses about their comfort levels for returning children to school, about a quarter giving each type of response. And we see a little bit of differences, especially between our urban responses. About 53% they said they were at least somewhat comfortable, and a little less than half, 49% of small town rural parents saying they were at least somewhat comfortable. And here we have links to different resources. We've been collecting polls and surveys with questions on COVID and education. You can access those at this box.com URL. And with that, wish everybody here to have a great APOR experience. It's really been a privilege. Thanks.
Hello, APOR. This is David Dutwin from NORC. As of this virtual conference, your past president of APOR. It has been an absolute honor to serve. Starting with a little bit of a review, you'll see some of the topics that we've done research on scrolling on the right. We've done over 50 surveys in the past 2 months on COVID-19. About half of them have been in the probability-based AmeriSpeak panel. As well, we've retooled our field interviewers to do contact tracing. We're currently conducting contact tracing in Maryland and upcoming in Delaware, and also are in conversations with other states. As well, we've been able to continue some of our real essential studies, such as the National Immunization Survey and other key vital research for the federal government. A couple of examples of the COVID research include the COVID Impact Survey. This is conducted for the Data Foundation, as well as a number of other partners, the Alfred P. Sloan Foundation, the David Lucile and Packard Foundation, the Federal Reserve Bank, Minneapolis, of course, NRC, and AP. Now, this is a multi-wave survey that's going to be continuing for quite a while, conducting about 9,000 interviews each week that it's fielded. It includes AmeriSpeak panel respondents, as well as an oversample of ABS via 10 states and 8 MSAs. It's great that the data is already available on their website. You can check out the link there. And these surveys ask a wide range of metrics, from sickness symptoms, mitigation strategies, and other impact of restrictions and other metrics. Just one example, the survey asks the American people whether they've had a family member or close friend die from COVID-19. About 5% are reporting yes. That is up from the first wave, where it was at 4%, an insignificant increase nonetheless. Some other interesting facts: the survey finds a great disparity by race and ethnicity, whereas only about 4% of whites are reporting knowing a family member or close friend dying. The same is true for about 14% of African Americans. Another survey is done for the John A. Hartford Foundation and the SCAN Foundation. Now, this survey is really focused on the experiences of people aged 70 and over. Over half have reported disruptions in their healthcare because of COVID, and amazingly, 1 in 6 have actually canceled essential treatment because of the pandemic. Unsurprisingly, over or around about half of older adults are being negatively impacted in terms of getting medical advice, managing their daily living, getting support to manage their medical conditions, and staying physically active. Of course, people over 70 are doing a lot of the things other people are doing. We're watching TV more, we're connecting via friends and family over phone and video more often, and we're spending more time on our hobbies. Another survey NRC has been a part of has been the Rustin D. Center for Social Sector Innovation survey. This is part of the University of Chicago. They have, this is a 6-wave study, not noted here, but I did want to point out, they did find that 40% of Americans still are not placing COVID as the most important priority for the US, and that there's a real substantial correlation between that and media distrust. Generally, their research focuses on income disparities. You can see a pretty strong linear trend in worry about losing one's job. And income loss already is highly skewed by income, but more so, and interestingly, it's not just persons of low income, but women of low income that are disproportionately impacted by COVID-19 with regard to their income. ARP, of course, is doing a great deal of research as well. Just to note a couple of findings, they report that the vast majority of Americans do not want to reopen the economy until we can have widespread testing. A smaller amount want to wait until there's a vaccine, and an even smaller amount want to reopen the economy right away. And though it's a small amount, you can see there's a substantial skew by party identification on that metric. Of course, as part of their mission, ARP probes about caregivers, and they find widespread support in helping caregivers, including being eligible to receive government subsidies to replace their pay during this difficult time. So that's it for me. Thank you for your time, and feel free to reach out to me if you have any questions.
Hi, Virtual APOR. It's great to see you all remotely. I'm Claudia Dean. I'm the Vice President of Research at the Pew Research Center, and I've been an APOR member for north of 2 decades at this point, and happy to be so. Like all of you, at the center, our personal and our professional lives were turned somewhat upside down by this international pandemic. The silver lining for me and for many others I work with is that the tools that we've spent so long perfecting are extremely useful right now in trying to explain to policymakers and others that are reacting in the moment what publics are thinking, feeling, worrying about, and like. In terms of the way we're reacting to this at the center, we are, of course, thinking about this as a breaking news crisis and attempting to shed light right now. But we also want to focus on the fact that this is going to be a long-term story about crisis and then about recovery, and that many of the themes and topics that folks like us and many of you have been studying are going to be turbocharged by this pandemic. Everything from the way people feel about governments to how they work, to how their faith plays out in everyday life. And so for all of us, I hope we take that as a bit of inspiration and a fuel to work hard. In terms of the how that we've been reacting and doing things in the moment, internationally in the beginning of March, we were all set to do a 50-country survey. Many of those countries were going to be face-to-face. And so that was our first moment where we realized, okay, something really has to give here. We were able to pivot. We will still be doing 15 countries. We will be doing them by telephone, but we had to let go of some of our plans for right now. And so reacting in the moment, I know for many of you, has been equally challenging. On the domestic front, we had a bit of an easier time methodologically. We have our American Trends panel. That's a group of 13,000 or so Americans that have been randomly selected to represent the country. And we're going to put up our methodology statement here and a link for you all to check it out. But we've been using that, and I wanted to just share a couple of the kinds of findings we've been able to produce. I think this slide is important. It shows the beginning of this crisis. It was our first survey in March, and we were asking people whether they thought there were different actions that states and the federal government were taking were necessary. And this is where you saw a nice moment of national unanimity across these different tactics, that people in general, most Republicans and Democrats, were unified. But if I show you this slide that's from a bit later, earlier in May, you can see that we still have a lot of unanimity in this country in terms of whether we see the pandemic as an economic threat. But when it comes to whether it's a healthcare threat, we're starting to see a partisan divide. And I think that that's something that other data has shown and that policymakers are grappling with, how to talk about the pandemic to these different groups. The panel, of course, because of its size, allows us to really focus in on important subgroups and the ways they may be impacted differently by the pandemic and by the recovery. We saw several examples of that early on, and were able to bring attention to that, as many of you were. One of them is looking at the economic impact of the pandemic. You can see here in this graphic that one bar really stands out. It's the fourth one down. And it shows that 6 in 10 Hispanic Americans say that they or someone in their household has been laid off, lost a job, or taken a cut in pay. And that far exceeds other groups that we studied. If you look at healthcare impact, you see something a bit different. Here in this graphic, you can see that about a quarter of Black adults say they personally know someone who's been hospitalized or died as a result of the virus. And that is about twice as high as in the other racial and ethnic groups that we were able to study in the survey. We are also trying to remember that we are interviewing a panel. So we are talking to the same people over time. In this graphic, you can see us trying to exploit that. We interviewed people at a 1-month distance, and we asked them if they were experiencing any kind of psychological distress. And here's an example of where you can see the top line finding wouldn't change, that about a third were rated as high in psychological distress in 1 or both months. But if you look underneath that, you can see that some people who were not so stressed out in March had become that way in April, and vice versa. You can see how the pandemic changes things and how opinion moves. And there are so many more topics we've looked at, including some projects where we have stepped away from survey work. We're able to take advantage of some of the amazing work you all are doing in the government statistical agencies to look at jobs and other things. We're also using our data labs team to look at social media and understand how different groups of people are communicating about the virus, including members of Congress. The thing I'd like to offer you as I wrap up is that we are trying very hard, in particular right now more than ever, to make this data accessible to you as people who are interested in surveys and expert at them. I think you'll really enjoy looking at our American News Pathways tool. We had been doing a year-long project looking at how people were getting information about the national presidential election. And we, as part of that, had made an online tool where you can actually do interactive crosstabs at multiple layers online. When the pandemic came about, we were able to adapt that to include our COVID data there. So please do check it out. You can find all our data really at the point of release and look at it by all kinds of important cuts. Wrapping up, I just wanted to say that from all of us in all our basements and attics and crowded apartments, to all of you, we hope that this finds you healthy. We hope that, like us, you're finding some comfort in doing meaningful work during these times. And I personally very much hope to see you all live in person next year.
Hey everyone, this is Michael Link at Apt Associates and a proud 30+ year member of APOR. I have a question for you. Are you staying at home as much as possible? Have you been self-quarantining, that is staying at home and avoiding contact for more than 14 days? Did you go out yesterday? If so, for how long? Why did you go out yesterday? We've heard terms such as lockdown, quarantine, shelter in place, and stay at home. These aren't new concepts, but in the context of the COVID-19 pandemic, they really do start to take on new meaning. This can be somewhat tricky for us as survey researchers to try to measure these important concepts accurately. So one of the things that we did was look at this by gathering about 1,200 different questions, part of an ongoing study that we have that are related to COVID-19 that have been published and are publicly available by various APOR associates, whether they are in universities or in various agencies. But these are questionnaires that fielded between February 15th and April 15th. We've coded those and we pulled out the ones that look like they were related to staying at home and did a little bit of analysis on those. When we looked at these questions, we found that we could really group them into 3 basic areas for kind of understanding. The first is what we might think of as in terms of a relative framework. That is, the phrasing of these questions and the question options are really quite general. There's really no reference point per se. Rather, each respondent frames the question within his or her own experiences. For example, are you staying at home as much as possible? Yes or no? A question without an objective reference point does make it a bit trickier for us to be able to understand exactly what it is that's happening. And it really does affect the interpretation of the question for us, as the responses can really vary dramatically based on various experiences of the respondents. Second area of questions, we might call those that involve a qualifier or some type of reference. These are questions that are associated with options that provide really a mental anchor or an objective reference point for the respondent. This may include a date, such as, have you gone out in the last 7 days? Or it might specify conditions under which an individual is staying home now when they otherwise might not have. For instance, have you stayed at home instead of going to work or to school or doing other types of activities? The specificity within the questions helps the respondent to frame and interpret and respond to the question in much more of the same manner across respondents. Which results in findings that are a little bit more, I think, easily understood and communicated and analyzed. Finally, we have a third set, which captures what we might say more detail on this particular concept. And it's typically looking at treating the concept as having multiple dimensions and leveraging multiple questions to look at those dimensions. As shown in the example here, a question such as, did you go out yesterday? If you did go out yesterday, then how long did you go out? How many hours were you gone? What were the specific activities that you took part in as you were out yesterday? As you can tell, that this starts to give us more of a specific focus for the respondent. It gives us a richer set of contextual data for understanding the scope of the activities in more clarity. These types of more detailed measures are really of greater use for really understanding some of the critical types of things that are happening, whether folks are adhering to the stay-at-home orders, how it is that perhaps social interaction is leading to increased spread. And these are the types of questions that you would leverage as well with trying to contact trace. individuals. As we all know, public opinion can really provide some fantastic information and much needed information here during the COVID pandemic. There are a lot of things that, while they seem familiar, are actually quite new in this unique context, and survey researchers are then kind of challenged to help be able to frame these particular questions. So we're making sure that we are accurately capturing the type of information that we want and need. As we all know, though, insightful information, which helps to drive action, is really a critical component for helping to curb this pandemic by being able to help individuals make decisions with data, marshal resources, and help those in need. I really want to thank you guys for taking out some time, and y'all stay safe out there. Thanks much.
Hi, everybody. I'm Gary Langer, president of Langer Research Associates, and I've been an APOR member for more than 20 years. The bottom line is that we've heard, I think, at presentations about the wonderful and deep research being done into the COVID-19 pandemic. The question for us was, how do we get our arms around all this research? There's so much of it across so many topics, it can seem pretty overwhelming. And our thought was to try to organize it in a retrievable, searchable way. What is SEAN? It's the Societal Experts Action Network. It's a panel of experts convened by the National Academy, supported by the National Science Foundation. Two missions: connect policymakers with this essential research, and to share this social science research with a broader audience, including the research community, the news media, and the public at large. The idea here is to leverage transparency for the public good. We seek to create a one-stop shop for essential survey research into the pandemic, based on the willingness of the producers and sponsors of all these studies to contribute to an open access, easy-to-use archive. You can search and retrieve individual survey questions and results, but we try to go deeper than that. We have reports, cross-tabulated data tables, data sets, scripted questionnaires essential for replication, methodology, and more. The collection, as it currently stands, houses more than 225 studies from more than 25 countries, more than 75 data sets, more than 2,500 questions. It's growing every day. It's housed on our knowledge management platform called PARC for survey researchers and their audiences. Now, what's in there is we're archiving data collected via probability sampling. Now, in creating the archive, our first question was, will survey producers and their sponsors set aside their competitive interests and contribute to the shared knowledge base? The answer has been resoundingly yes. And this is a list of additional contributors, again, growing every day. In addition to maintaining the SEAN archive, we're producing in our shop a weekly summary of key results from the previous week's new studies. The typical topics are listed here. This goes out every Friday. Here's an example of what it looks like, and you can sign up at the link below if you'd like notification of these weekly summaries. I think we should be great to just jump in real quick and get a look at how the archive operates. Go to search. What do we care about? Let's say we want to know, has anyone asked any questions about the use of masks? I type the word mask. I'm searching top lines. I hit search. And I get every question that's been asked that's in the archive with the word mask in it. As you can see, there's 42 questions. Reverse chronological order means the most recent is this May 20th Fox News study. You can click results and see the question and the results right there. Click the source folder, and we have all of the materials that Fox so kindly shared with us on the study. Now, mask may not be sufficient because we're losing the plural, masks and other forms of the word. I can put in an asterisk to make it a full Boolean search, hit search. In this case, I find 59 questions. And again, we can look through, grab any we're interested in. There's an Axios Ipsos survey, and we can look in the folder and see. And we have analyses, we have crosstabs, we have the raw data set, top line of methodology, other materials. So that's pretty useful. In addition to searching for the top line, we can search for the scripted questionnaire. And now you can see there's a Kaiser Family Foundation survey, and we've got the codings. And if we want to replicate this question, we do want to know exactly how it's been asked in the past. There's 28 questions here. Another way to look at it is to hit project only. In this case, instead of seeing every question with the word mask in it, we see every project that has a mask question in it. And in this case, we can see the metadata associated with each project. and click on the source folder for the materials we have. There are many other ways that Park is searchable and functional. We can search analyses, that's any Word, Excel, text, PDF, or PowerPoint document, full text search and retrieval. Just for example, we'll grab the first one that pops up. You can see what that looks like. Other ways to use the system, if you have any questions, please reach out to me at glanger@langerresearch.com. Thanks for listening. I just want to say again, the willingness of the producers and sponsors of these data to contribute has been really one of the most heartening aspects of this project. And it really does, I think, remind us all that the people of APOR make us strong. Thank you so much and take care.